this conversation is not just happening in our community. It's not just happening in New York. It is happening all over the country, and that we do need to, extend it and be able to have that bilateral conversation, like you were saying, because there is a little bit of a sense that you are not allowed to discuss hard topics that involve mental health or drug addiction or crime in a rational way or in a reasonable way because of some political pressure or, whether or not it's considered en vogue.
It's an incredible honor to serve our community in such a unique way. As we listen and research, as we visit with people representing every type of background you can imagine, as we take in stories of triumph or despair, as we all ride these incredible times together, we recognize that at the end of the day, those committed to doing good want to be able to have honest and balanced conversations that offer real solutions for all. Here's where we come together to do just that. Welcome to The Balanced Voice. I'm your host, Rania Mankarios.
Special thanks to our podcast sponsors, Brigitte and Bashar Kalai, Hallie Vanderheider, and Sippy and AJ Karana.
Thank you for joining us. Today, I sat down with Dr. Megan Martin, a mom of two, a master's in public health, and a physician. She is also a member of the Upper West Siders for Safer Streets out of the Upper West Side of New York and a president of the West Side Community Organization. What is so fascinating about Dr. Martin is she is part of 15,400 other New Yorkers who are demanding public safety for their neighborhoods. We're going to jump in here, everything they're doing and why what they're talking about matters here. Let's jump in. Dr. Martin, welcome.
Thanks for having me.
I have been following you and the work that you've been doing for weeks now and felt it was really, really important to have you as a guest on The Balanced Voice. One, because our organization is a community-driven public safety nonprofit. We look at safety issues all the time and try to create solutions. And what's happening on the Upper West Side, what's happening in New York City as a whole, has been something that's really, really interesting to me. So first of all, thank you for everything you're doing. And I want to say that you are an absolute example of power, the power of community when it gets behind something, and you're moving the needle greatly in Manhattan. So can you take us back to the early beginnings? Explain the problem in the Upper West Side that got you to sort of activate and start working towards solutions.
Absolutely. I have been living on the Upper West Side for 7 years. I'm a lifelong New Yorker. My parents were born in Brooklyn. My grandparents came to Brooklyn from Eastern Europe. So we feel very connected to New York. And I've always felt extremely safe living in New York. My husband and I have dedicated our lives to raising our children in New York City. And we have seen really over the past maybe year or 2 years, a change in the community that some crime that is happening where cell phones have been stolen, where there were actually a pretty significant incident on a playground where there was gunshots fired during right after school at a local public school. It alarmed the community so much that another Facebook group was started. So we really all started paying attention pretty closely. COVID then, totally changed our community, just like it changed the entire United States and changed the world. But what happened specifically in the Upper West Side was that the utilization of hotels for homeless shelters. And we didn't just have one hotel utilized, we actually had 3, and almost 800 mentally ill, chemically addicted individuals were moved within a 10-block radius in the Upper West Side. And we have a quite residential neighborhood. It's a lot of families, a lot of senior citizens. And in July, when almost 300 men were moved, they were described as being on methadone treatment. And as an anesthesiologist, this really did raise a lot of alarm bells for me, because I do have a lot of experience dealing with people with chemical addiction, who have either recovering of substance abuse and active substance issues. And so, this was the impetus to say, okay, I need to get involved something is happening to our community that feels that it's wrong, that we are seeing this increase in safety issues in our community. Our politicians are not responding. Many people have been reaching out, but we don't feel that our voices are being heard.
So when you walk us through the story, was crime already changing in your neighborhood pre-COVID?
Crime was changing pre-COVID for sure, but what we've seen post-COVID has been a pretty dramatic increase. I think COVID just kind of uncovered a lot of the issues that we were experiencing.
I was reading, just in researching you, some just random stories. One from the City Journal, August 9th, 2020, a man doing his part to support the pandemic-era economy and urban street life was simply eating dinner outside with his wife at 75th Street at 75th Street in Columbus, was punched by a stranger. The next day in the afternoon, so midday, a woman exiting the 72nd Street subway station was stabbed by a stranger. In both cases, neither attack was instigated. And what's so interesting about this is a lot of people actually think of New York as this crime-ridden, dangerous city, and it's really not. It's a very pedestrian-heavy, it's a busy city, but it's not a city. I know many nights and weekends I've spent in the city. I feel very, very safe walking down the streets of New York, but from a lot of my friends and colleagues who live there now, they're saying that the city's truly changed, and you don't feel as safe walking down the streets. In comes COVID, where, there's been almost no foot traffic, and this infusion of, you're saying, almost up to 800 mentally ill men in local hotels. And obviously it's cause for concern. But what's been so interesting is the response. Are you being called a hero for stepping in, or is it that you don't have compassion, that you're an Upper West Side snob and you just want to keep your neighborhood pristine and clean? I mean, what has the response been like for you?
It's been so interesting because I've lived a very anonymous life in Manhattan. I think a lot of people who live here, are able to walk outside. You go to your local coffee shops and your local grocery stores, but that you don't have that suburban community maybe that you do have when you live in an urban environment. But at the same time, I think this has really forced people to get to know your neighbors, because we had to turn to one another and form this organization in response to what we were seeing. And in turn, we were vilified, that the answers were simply, well, you just don't want to see homelessness. And really, from my point of view, not just as a parent, but as a physician, it's that, no, this has nothing to do with homelessness. This is an issue of mental health. This is an issue of crime. We are having needles in our playgrounds. We're having overdoses in our medians. Men are exposing themselves. We have multiple images of masturbation on our landmarks, on our historical society steps. We are having, just like you said, unprovoked assaults. I mean, those were incidents that happened in August. They happened last weekend. We actually just had an individual assaulted on a Thursday morning at 7:30 in the morning. Sunday afternoon, I was the witness of a pretty vicious assault of a robbery that didn't go right, and the 4 or 5 individuals actually assaulted one of the workers on Columbus Avenue, which is, people may not know exactly where this is, but on 70th Street, it's a very safe area. I've lived here for 7 years. I have never witnessed anything like this. I would never think twice about bringing my 2 small children around walking or in their strollers. And I was so upset that I actually called my husband to come and walk me home. So this is a really dramatic change in our community. And what the reaction of our politicians is to say that you don't want this in your backyard, but really is that this shouldn't be happening in anyone's backyard.
And I think that's infuriating, by the way. And it's a really low blow by the elected officials who are charged with serving the community. Because, by the way, throwing up to 300 men in a vacant hotel does nothing for the business economy, but also does nothing for those men who need treatment and oversight and help. We talk as we're reading, kids are seeing addicts shooting up drugs. I mean, is that what you want to see is that what you want your child to see when you're just walking down the street? Witnesses filmed paid sex acts in the streets, incidents that can, considering the incapacitated condition of the so-called sex workers or partakers in the sex act, were actually assault. And this is what you're just seeing on the street. So for the response to be that you don't have compassion and you just don't care about the homeless, I think is disingenuous and offensive. I think what you're really saying and what we're hearing is that this is not the solution, and it's a lose-lose. It's a lose-lose for those in the Upper West Side and across any major city, people who care about their community, want to invest in their community, want to build their homes, their schools, have their kids play in the playground. And it's also not right to those who need treatment. And it's not a fair statement for the elected officials to make. So I sort of know the answer of this, and this is why I'm so intrigued by what you're doing. How have you leveraged Mayor de Blasio and all the elected officials who have been somewhat disingenuous in their response to you?
So the community has really come together. So the Facebook group has, like you said, is over 15,000 people. And when you have 15,000 voices, it's hard to ignore that, because it's not just 15,000, that's 15,000 households. So that really represents such a significant portion of our community. And then there's more than that. I mean, I have conversations with people who are not on the Facebook group. And in turn, we've collected photographs, we've collected videos, we've collected so much objective evidence of this is what is happening in our community. And the media has brought light to really what are the problems that are happening here. These are real problems. We need to find real solutions. And even though our elected officials don't feel the need to do anything to really find these solutions, our community is dedicated to living here, to revitalizing our economy that's been devastated by COVID, and that the answer is not, well, there's nothing we can do, because we know we can solve these solutions. We have lived through 9/11. We've lived through the financial crisis in 2009. New York has always been a community that knows how to find its way out of problems. And so we just really don't abide by the idea that nothing can be done. Like you basically don't instill one problem with another. COVID cannot be the only answer when you have more problems that you've committed to a community.
And I think that's such an interesting point. And I'll say there are many polls out now that say that actually the number one concern for average citizens is safety. It's no longer COVID. Do you think it's a fair response? Do you think these elected officials are playing politics, or do you think they genuinely feel that throwing, large groups of people who need help, but just throwing them into vacant hotels, that this has been a true solution, that it's really in the best interest of those who need treatments and service, and it's in the best interest of the neighborhood? Or do you think, are they playing politics? I mean, what are they doing?
I have to say, I do think a lot of this is playing politics, because if the initial solution was to de-densify the cluster shelters, that was in March. But now we're talking about, this is October, and a lot of the relocation that happened in our community was at the end of May. And especially with the particular hotel that really is the impetus for this conversation, the Lucerne, was at the end of July. And we know that move had nothing to do with COVID. Those individuals were at another hotel in Hell's Kitchen, and the community there actually reached out to Corey Johnson, who's the Speaker of the City Council, complained about the same quality of life problems that our communities face: open drug use, defecation, crime. And he had requested through the Department of Homeless Services to have the individuals at that hotel and the nonprofit relocated to another place. And I'm not saying that they specifically asked them to be moved to the Upper West Side, but they had them moved, and therefore the problem really was just shifted to the Upper West Side. So when we're discussing whether or not COVID, the politicians seem to care more about COVID or their own political will. it really feels that politics seems to be taking the forefront of their agenda here.
And this is just something I read online, and we all know that you can take it with a grain of salt. So I don't know if this is real, but in reading about what's been going on specifically in the Upper West Side, and of course across all major cities across America, it seems that some municipalities have become extremely extreme in sort of their activism, their positions, and the way that they govern locally. And that could be what's happening in New York. I don't know. But I've read a lot that seems to be what's happening, to the point that local elected officials almost want to, and again, this is just reading online, punish those who seem to have so much wealth and say, this is real life and you need to get a good dose of what real life is. And you're not going to be in a bubble. Yes, you're not in a gated community and you shouldn't be in a gated community. I mean, that's an extreme statement. And I can't imagine any local municipality would almost want to punish those who are doing well and providing. But I also don't know the answer. I mean, could there be any truth to that? You've been in those meetings. You've heard local elected officials talk. Is it crazy what I'm seeing and what I'm reading?
It's an interesting concept about living in a gated community in Manhattan, because if people wanted to live in gated communities, they certainly wouldn't live in New York City. We obviously don't have walls. We have no backyards. Our backyards are our streets. The Upper West Side has actually always been known to be a welcoming community. We actually ranked 9th out of 59th district in terms of shelter beds. In comparison to other so-called wealthy communities, we have 1,100 shelter beds compared to the Upper East Side that had 80. And that's according to data from September 2019. So that doesn't even take into account the shelter beds that were moved in since May. So, it really is hard to say that where the distribution of shelter beds and the where services are being withheld or being provided in terms of where wealthy constituents live. There is fair share that exists in New York City, and it exists for a reason, because resources can only go so far. We are very stretched in our community. We have a very densely populated community. We have a lot of supportive housing that is in our neighborhood. And we know that we are going to be experiencing a lot of budget cuts just based on the fiscal projections for the next coming year. So, it's important that we look at all these things to make sure that we're not going to be shortchanging anyone who lives in any community.
And I think that's so important. And and reading again the posts and sort of the spirit behind what you're doing, it's not for a lack of compassion. And I'm a big advocate that wanting public safety for yourself or your loved one does not equate to a lack of compassion for others. It's wanting it for me and for you and for him and for her and this neighbor and that neighbor and this zip code and in that zip code. And sometimes the solutions proposed by local municipalities have to be challenged, because if they're political in nature, and the outcome is not contributing to the health and wellness of safety of those of their electorate, it's incumbent upon us to do something. And I'm so proud of you for actually doing something. We talk about public safety every day, and we often feel like we're sort of alone in this world talking about these issues. And to couple that with somebody like you who and all the many members, now you have, as we said, over 15,000 members, and I read the posts and I'm very in tune with what's being shared. There's been a lot of love and compassion and outpouring. There's been a lot of, okay, how can we create solutions? And you guys have been working towards solutions. You've been trying to leverage community members to get involved. Talk to other people listening about how communities can rally behind identifying a problem and then coming towards solutions.
Yeah, so social media has been such an important part of this, because especially 2020, we are socially distanced. We are not having these large gatherings. And, as someone like myself who really has never been an active member in community activism, in organizing, the first thing I did was start reaching out to our local officials and finding myself not finding answers, not hearing any solutions from them. And so the next thing that I realized, okay, so how do I find like-minded people? And there are block associations that exist in our neighborhoods, but that really was restricted to only people who live within those geographic regions. So social media was something that allowed us to find one another and to say, okay, these are people who care about this issue, that really want to do something and to make change. And that was how the conversation got started, where, okay, we see a problem, we are not having our voices heard, we do feel disenfranchised, we do feel that our politicians do not want to see that safety as a priority, that we do, that really the only expectation that I have of my elected officials is that I can walk my children down the street and not be afraid of having them being harmed, or that I will be harmed. And that's what makes New York so great. And it's that maybe there is that fear maybe outside of New York City that there is crime, but for someone that's lived in New York City, it is a very safe place. I mean, we really do. We have one of the best police departments in the entire world. Anti-terrorism units. I mean, it's something that we're so proud of, that's been since I'm a child, that has really turned New York City into one of the havens that has brought in tourism and culture and restaurants that people come to. And we want to make sure that it stays that way. So that's the conversations that we're having in the Facebook group. And that's why the organization was started, because we really felt it was an important thing for people to have a voice and to organize together, and to then reach out to other areas of New York City who also feel the same way, and to have a collaborative effort amongst like-minded people around the city. Because I know that the Upper West Side really just represents a microcosm of what's happening around the entire Manhattan, around the entire New York City, Queens, the Bronx, Brooklyn. I mean, this is not just the Upper West Side. We just represent a very small area that is it's happening to.
And again, to the point is, you're not saying that safety needs to stop around the jurisdictional lines of the Upper West Side. You want to see it for all communities across all of Manhattan, and ultimately understand that it should be for every citizen across this country. Mm-hmm. This isn't something that you and I have ever even talked about, but when you see what's happening and sort of the decisions your local elected officials are making in New York, and we're seeing decisions that local municipalities are making across major cities across this country, the defund police narrative, there's bail reform, there's a lot going on. Is this an issue now? Are these issues now that you're starting to really look at, whereas maybe a year ago or 2 years ago, they weren't even on your radar?
Oh yeah, we have very long discussions about bail reform. It's something that's directly impacted us. We actually have had multiple car break-ins along Riverside Drive and 77th Street, and the 24th precinct in our community did catch one of the perpetrators, and he's someone who's arrested 30 times and has then since been released again, and is out on bail because of this new law. And so the conversation is, well, what does it take for them to actually be held and to not have another victim? Because as Commander Yaguchi said, this is not a victimless crime. The person whose car is broken into spends hours in the precinct reporting the crime, going through their insurance, their items are stolen, they feel personally violated. And so that's just one vehicle. I mean, we are experiencing this on such a high level here. And when we listen to our elected officials who put these laws into place, they're so tone deaf to what the actual repercussions are on the average citizen. So we are having these conversations about the larger laws that have been put in that they seem to not have thought about who's going to be impacted by them.
Yeah, and it's such a big issue for us, and it's one that I wish I had a louder voice on, because we've been saying, across this country, we've had this discussion on misdemeanor bail reform, and everybody's agreed. We don't want to hold people who've committed low-level, one-time offenses hold them where it hurts their ability to get back to work, to get back on their feet. They're going to lose their job. We don't want to create a negative effect for those people. But there are other situations where it is clear that there are people out there that are living a life of crime. They're going to commit this crime. They're going to commit the next crime. You're going to arrest them. You're going to release them because you're going to have compassion on them. And there's this now felony bail reform, and they're going to go right out and commit another crime. And what we're seeing is they're breaking into a vehicle. They're also raping a girl. They're also committing murder, aggravated assault, robbery, and they're getting arrested and re-released into communities over and over and over again. And where do you draw the line? It's interesting when people say, well, there are some victimless crimes, like breaking into a business and stealing cell phones, or breaking into a car. That doesn't really hurt somebody. But like you point out, it actually really does. And what's interesting is in our city, last year, just looking at the number of cars that were broken into, call it a victimless crime, but hundreds and hundreds, actually thousands of guns were stolen from those cars. So those are guns out on the street right now. So we've got to be looking and asking questions. This movement of local municipalities changing the lens, being tone deaf, I think is creating great harm for our cities. But what's so great about what you're doing is you mentioned 15,400 members. That represents 15,400 maybe households. In each household, you might have 1 to 2 voting members. That's enough to change a complete slate in an election.
Yeah, exactly. And, and just to the point of even the stores that are being robbed, we're having a lot of empty storefronts, and there's a problem in them sort of revitalizing after COVID. So these stores that are being almost assaulted through at night, they have to then pay for the glass to be put back up, whatever inventory is being stolen. I mean, this is and their workers don't feel safe coming into work the next day. So this is a real problem, especially in our community. And so, we're really advocating for the police to try and have more presence on the street. But something that has been done, especially in our community, is that they've taken plainclothes officers off of the streets. And so that has contributed, I think, to part of these so-called victimless crimes, because they're no longer canvassing the neighborhood.
I always say, when did we lose the ability to have 2 conversations at once? We can talk about police reform, which is so necessary, without removing plainclothes officers, defunding. I think in New York, they're looking at $1 billion, maybe that's passed from NYPD, without making all law enforcement bad and making it impossible for them to work, to swinging the pendulum, to having this completely irresponsible bail reform, at least on the felony side, to moving people who need services into just regular communities where they're not only hurting themselves, but they're hurting those who are trying to make a living. When did we lose the ability to have reasonable, balanced conversations? And that was the whole point of this podcast and your show and this show, and watching what you're doing has inspired me and wanting to have this conversation with you, and hoping that other people across the city will tune in and see what you're doing. I know your group is a closed group, but people can read about you. They can see a lot of the stories you're doing. What are you hoping for in New York? And then are you hoping for anything across the country, or are you focused mainly in your area?
So we actually have been reached out we've been approached by other groups. One group in Boston in particular that's also having problems in their community with sort of shelter individuals that the politicians have in their view, have abandoned their concerns with increased drug dealing, increased drug use, increased crime. And they have sort of seen us as a model, as a community that's organized and has pushed back and said that, no, it is not okay to just let these crimes go, without question, without having any repercussions, and that, the degradation of the neighborhood has an impact on everybody. And it doesn't just, it's not okay just because it's a pandemic. It's not okay just because we have economic recession. we have to, address all of these problems. And for people who are, trying to make a living, trying to go to work, trying to use public transportation, this impacts us all. So it really did, it felt like we do have a larger reach on a national level, that this conversation is not just happening in our community. It's not just happening in New York. It is happening all over the country. And that we do need to, extend it and be able to have that bilateral conversation, like you were saying, because there is a little bit of a sense that you are not allowed to discuss hard topics that involve mental health or drug addiction or crime in a rational way or in a reasonable way, that because of some political pressure or, whether or not it's considered on vogue, I guess.
I mean, that statement right there, I can't even tell you sort of the feelings it elicits in me. And in the work that we're trying to do, the need to have important conversations in a graceful manner, saying that we can have two conversations at once. And, we want to ensure the safety of not just the Upper West Side, of every community across this country. We want to pour in resources where they're needed. We want to treat those with mental health issues, with drug addiction, with whatever the issue might be. We want to have compassion. But we must demand better. And it frightens me when I kind of take a step back to look at the movement on bail reform and where we were way before COVID ever started, and the coupling of misdemeanor bail reform with felony bail reform, with this defund police narrative across the country, with punishing anybody that asks questions about it, with categorizing them in the most horrific way. We're moving away from it, and we're encouraging people to move away from it, to follow your lead, to look at what you're doing in New York, Boston, and other cities across America. Where can people go to follow you if they want more information about what you're doing?
So we do have a website, westsideco.org, and we're always happy to have conversations with people. We're on social media at westsideco.org, _.org. And I think it's important that we all just continue to use our voices, because we're stronger together. I think that, what's empowered me as someone who, like I said, who's always really not taken a lead per se in political activities or community organizing, is that safety is the priority in my mind. And when we aren't allowed to have conversations about safety, then we sort of lose our way as a society. And that's where we have to bring the narrative back. We are going to need safety to lead us for economic recovery. And if people don't feel safe, they're not going to want to stay in communities. So that's really going to be the best way for us all to heal, especially like post something that's been so traumatic like COVID. And we are stronger together. We're stronger as numbers. And if it's helpful that, people like myself and other people in our leadership who feel that it's okay to say these things out loud, I guess I'm happy to put myself out there and do it, because I want my children to grow up in a world where, things that are important, it's important to say it, and it's important to lead by example. So, and I want them to grow up in a safe community. And that I do this because of my children. It's I think I will be okay. I've managed to get through life so far, but I have a 5-year-old and a 3-year-old, and my whole world is about them, and it's the world that I'm leading them into, and I want them to be in a safe world where we have dialogue and where your opinion is allowed to be expressed. And those are really, really critical things for me.
And I think, Dr. Martin, you've been doing it in grace and compassion. And again, we support the work you're doing. We want your kids to grow up in a safe neighborhood. We want our kids to, and we want every other 3 and 5-year-old across this country to grow up in health and safety, and to work together to ensure that for all, by having important conversations and letting local municipalities know that we will come together to ensure that that's given to our communities. So we thank you for being a champion. We wish you guys the most health and safety in New York. 2020 go away with COVID and everything else.
Agreed.
And we will see, we'll be following what you're doing, and we'll keep up and keep in touch. So we thank you so much for being on the podcast, and we'll catch you guys all next time.
Thank you so much.
Thank you.
Hi, everybody. Thank you for watching my sit down with Dr. Megan Martin. I have just two takeaways from today's conversation. The first is the power of the community. Dr. Martin, again, a mom of two, really got involved along with 15,400 other New Yorkers who want to see a change in their community and are doing something about it. I think that's inspiring for all of us across America. But the second is that public safety can be something we wish for in our communities. And it doesn't go against having a heart of compassion. There's this narrative that those of us who want safety do not have compassion for others, and it's simply not true. We want a safe community for ourselves, for our kids, for our homes, for our neighborhoods, but we also want that for you, wherever you might be. And we want to work together to ensure the health and wellness of all and the safety for everyone, no matter where they live. So we thank you for tuning in, and we hope that you'll be inspired and encouraged to get involved. Thanks again. If you missed anything from the show, check out the show notes at thebalancedvoicepodcast.com. This episode was edited and mixed by the team at Real News PR. Our executive producer is Sydney Zeicher. Our advising producer is Katie Myers. Our media and quality assurance director is Tanya Cruz. And finally, our creative design director is Elizabeth McChesney. To find out more information about Crime Stoppers of Houston or to get involved with our prevention programming, please visit us at crime-stoppers.org. You can find us on Instagram at The Balanced Voice Podcast, and you can find me online at The Run Your Report.